Hi, my name is Dr.
Gaukhar Baidildinova.
This video is a part of my lectures on evidence-based medicine and epidemiology. We're moving away from case control studies toward cohort studies. They can be retrospective, prospective, and ambidirectional. First, let's define what the term cohort means. The word came into English from Latin. This was the name of a tactical unit of the Roman army, which included 360 to 600 soldiers. It is not necessary to draw a direct analogy. In cohort studies, there may be several tens of thousands of participants, but the main thing to remember here is that this is a study with a large number of people. This is still an observational study, that is, where you just observe the subjects and take no action. Cohort studies are the best method for determining the incidence and natural course of disease because you are taking people who are grouped together in some way. A study starts with some intervention factor such as a drug or physical activity, and you keep observing people until some outcomes. People with outcomes will be cases, and those without, controls. The relative risk, RR, is a measure of association for a cohort study. Relative risk is the same as risk ratio or proportions. Sometimes a measure of association is hazard ratio. As I've mentioned, cohort studies can be retrospective, prospective, and ambidirectional. Retrospective is when we look back in time, talking prefix re. Prospective, when we look into the future. A retrospective cohort study is the collection of data for a cohort that was formed sometime in the past. Exposure and outcomes had already occurred at the beginning of the study. The cohort is observed retrospectively. You study a risk factor and see if it might be associated with a disease. People are divided by exposure. Retrospective studies are much cheaper because the data has already been collected. No bias because the outcome of the current interest was not the original reason for collecting the data. However, since the information available was not collected for the purpose of the present retrospective cohort study, there is a high probability that all the necessary information will not be available. Retrospective cohorts also suffer from the disadvantage that people with the outcome of interest are more likely to remember certain antecedents or to overestimate or underestimate what they now consider to be risk factors, recall bias. The same problem is characteristic of case control studies. Another potential problem is a failure to control for all other factors that may differ between the two groups, intervening variables. A prospective cohort study. A group of people with no interest in the outcome, e.g., myocardial infarction, is selected. The researcher then measures many variables that may be relevant to the development of the condition. The people in the sample are followed over a period of time to see if they develop the outcome of interest, i.e., myocardial infarction. In single-group studies, those individuals who did not develop the outcome of interest are used as internal controls. If two cohorts are used, one group was exposed to or treated with the agent of interest, and the other group was not exposed, thus acting as an external control. Examples. My lab has several cohort studies. My colleagues have the myovasc cohort. Let's look at an example from a recently published article, how the study is described. This is a large epidemiologic prospective cohort study of people with heart failure. There were 3,289 participants recruited at the beginning. The follow-up lasted more than 5 years, and there's also a control group for comparison. That's the whole point. Gather people with some disease and observe them for years. An ambidirectional cohort study is a type of observational study that combines aspects of both retrospective and prospective cohort studies. It uses existing data to document past events while also monitoring future outcomes. An example of an ambidirectional cohort study would be a research project investigating the link between prenatal marijuana exposure and child development, where researchers would retrospectively collect data on mothers' marijuana use during pregnancy from medical records and then prospectively follow those children to assess their developmental outcomes, allowing them to analyze both exposure and outcome information within the same cohort. If you would like to describe a cohort study, you must do it based on the Strobe statement, which can be found on the equatornetwork.org website. I also have 2 paid courses on Udemy. The Critical Assessment of Clinical Studies teaches how to read and critically evaluate clinical studies. It's a very great course. The same as my second course, Scientific Writing, where I tell all the nuances of how to write a scientific article or dissertation. Links are in the description box. A cohort risk study is also called an incidence study because the primary method of assessment is to record new cases of a disease over a specified time period. Risk factor studies are usually conducted on healthy people, whereas prognostic factors, conditions associated with specific disease outcomes, are, by definition, studied in patients. In terms of prognosis, many outcomes are considered, including death, complications, relapses, and disabilities. There are 6 types of disease outcomes: 6 Ds: death, disability, disease, discomfort, dissatisfaction, and destitution. Financial difficulties. Also, of course, patients can become healthy or at least go to remission. Although cohort studies are scientifically preferable, this approach cannot always be applied in practice, because such studies require a significant investment of time, effort, and money. Therefore, you should be sure you apply them wisely. So, for example, when a particular outcome is rare, a prospective cohort study is ineffective. For example, a study of diabetes mellitus outcomes in 100 paramedics with minor trauma is likely to yield only 1 patient with the outcome of interest. Another early example cited is Creutzfeldt-Jakob disease. The effectiveness of a prospective cohort study increases as the incidence of any particular outcome increases. Thus, a study of patients diagnosed with intentional self-harm within 12 months of initial referral would be effectively studied using a cohort design. Another problem with prospective cohort studies is the loss of some subjects to follow-up. This can significantly affect the outcome. Taking incidence analysis, incidence equals cases per time period, it can be seen that the loss of a few cases will seriously affect the numerator and hence the estimated incidence. The rarer the incidence, the more significant this effect.